Hello, my name is Dr. Teresa Joyce, and I am back. And today I'm here to talk about what exactly is occupational therapy because I am a children and young people's occupational therapist and the director of People's Occupational Therapy. So, if you have never heard of occupational therapy, you are not alone. Most people actually haven't heard of occupational therapy, despite the fact that we are in almost not even almost, literally all hospitals, at least within the UK. And we also work in social care settings and in education. So we are everywhere, but we're pretty stealthy and sort of quiet people. So you might not necessarily know that we are an occupational therapist when you are speaking to us, which is on us, and we need to be better at that. But where a lot of people get confused is they think the occupation means job. That is not true. Occupation does not just mean job. It's actually quite an old-timey word. And this old-timey word actually means all of the things that you need and want to be able to do. So, occupation is just a way of saying how do we occupy our time? And as occupational therapists, we split this into three areas. The first area we think about is self care. And sometimes when we think of self care as a general population, we think about bubble bath and face masks and lots of sort of nice things that you might do occasionally. But as an occupational therapist, when we are talking about self care, we are actually talking about everything you do to look after yourself. From waking up in the morning and brushing your teeth, getting in the shower, putting your hair up, making yourself a bowl of cereal, ordering that bowl of cereal, or walking into the shop and getting that bowl of cereal, so buy your groceries. Anything that you do that kind of sustains you and keeps you alive and going. We're also interested in what we call productivity. And in children's occupational therapy, this is often what you're doing for school. So the handwriting demands, learning to use your computer, organizing your bag for school, as well as participating in all of the school activities, like being able to participate in assembly and break time with your friends, and being able to actually engage in the tasks that are asked of you at school. Children's services now in the UK, including People's Occupational Therapists, now go all the way up to 25. Because what previously happened was you would hit 18 years of age and you would fall off a cliff and there would be no services available to you, despite the fact that when you get to 18 years old, a huge amount of life change is happening to you at that moment. And it's one of the times where you probably need the most amount of support. So, what's happened instead is we've decided that services need to go beyond 18 and go all the way up to 25. So that means that productivity no longer only means school, but it also means university and higher education. And it also means early employment as well, because of that age that we're now covering. We are also interested in the things that you do for fun because occupation is everything that you need and want to do. So, if you are interested in playing a hobby, if you are interested in going and socializing with your friends, or learning how to bake for the pure pleasure of baking, we are interested in that and we want to help you to be able to do this. We work with people who might find any of these areas of activity challenging, or all of these areas challenging, for a variety of reasons. So, this could be because of a neurodevelopmental disorder such as autism, ADHD, developmental coordination disorder, or dyspraxia. It could be because of a mental health condition like anxiety or depression. It could be because of a physical disability, like, for example, having a spinal cord injury that means that you have to use a wheelchair. Or it could also be because of an environmental cause, like, for example, something like displacement. So, as you can see, occupational therapy is very broad. And I'm only specifically here focusing on children and young people's occupational therapy because this is what people's occupational therapy is interested in. I can also take you through all of the areas that we can specifically work in. So, when we work in schools, how we can work with teachers, the approaches that we use, when we work one on one with children and families, the different approaches we can use there, how we structure our reasoning, how we integrate evidence into our practice, how we engage with research, how we also develop the research, because I'm also a researcher and I have a PhD, and that's something I'm very passionate about as well. So this is just a whistle stop tour to give you an idea of what is an occupational therapist. And let me know if you're interested in how do we do occupational therapy, because that should be the next video that tells you a little bit more about exactly what it is that we do to enable children and young people to be able to participate in life as meaningfully as they want to be able to participate. Thank you so much for listening, and like and subscribe and let me know the types of videos that you would like me to create. These can be about occupational therapy specifically, telling you more about the profession, but they can also be about any of these areas that we work in. So, for example, it might be that you want tips on toilet training a child who has autism, because that's an area of self care that we work on. Or it could be that you are a university student and you want support in organizing your belongings, structuring your time, or writing assignments. So, let me know, and I will do my best to continue making these videos and get back to you.